I'm sitting with Dr. Netta Shaked in Miami Beach, and we're in her office. She is a psychologist. She's been dealing with patients for over 15 years, and she deals with women that have postpartum depression. And today she's going to tell us about postpartum depression and how to deal with it. Doctor, thank you so much for being with me today.
Thank you so much for having me.
Pregnancy and having a baby is such a beautiful thing. And I've been dealing with pregnant women for, at this point, 10 years, since the year 2000, and it's always so nice to deal with them. But there are doomy or gloomy parts of it, aren't there?
Indeed there are.
And that's postpartum depression, which we have heard for a long time. How does a woman know that she has postpartum depression, and or how does a spouse or a partner know that his wife or his partner has postpartum depression?
Well, it's a great question that you raise. One of the organizations that I deal with, Postpartum Support International, their mantra is regarding postpartum depression, you can't tell by looking. Meaning that a lot of times women with postpartum depression might experience significant symptoms on the inside, but somebody from the outside just won't be able to tell.
This definitely affects the dynamics of the family.
Oh, indeed.
How does it affect the bonding with the baby or the relationship with the husband or other family members?
Sure, that's a very, very important issue to raise as well. Well, we know for a fact that the bond with the baby is impacted. A mom who's suffering from postpartum depression might not want to be with her baby, might even have thoughts of harming her baby or a feeling like she wishes she didn't have her baby. This obviously impacts the bond. In terms of how she would relate to her partner, oftentimes the partner might pick up that something is just off. Mom is just not doing well, she's excessively tearful, she's not really empathic towards the baby, and the partner might try to assist, but might just fail simply because the partner might not have the tools to help mom through this period.
Is there any predisposition for women to get postpartum depression? In other words, do more women in the Middle East, let's say for example, or in America get postpartum depression as opposed to Latin America?
What we're seeing in the research is that women across the world have the same rates of prevalence for postpartum depression. And what we know today is that about 20% of women who are pregnant will have postpartum depression.
Do you know if there are any nutritional factors involved in postpartum depression, or is it just something that can hit anyone?
It can hit anyone. A woman who's had depression in life prior to being pregnant is more likely to have postpartum depression. A woman who is pregnant and is experiencing significant stressors might also be more predisposed than other women to have postpartum symptoms. But nutrition is actually a huge component, because oftentimes when one is clinically depressed, one doesn't eat properly, which feeds the depression and feeds the fatigue, and then, of course, a vicious cycle ensues.
How early on does a woman start having postpartum depression?
That's really, I like that you're asking that question, because I get asked that a lot, and I'm going to actually segue into what is baby blues versus what is postpartum depression. So about 80% of women will experience baby blues. Baby blues peak at about day 3 to 5 after delivery, and the predominant mood is still a happy mood, although she might feel tearful and sort of respond to stressors in an unlikely way by crying or by feeling a little bit more irritable. A woman who has postpartum depression will have a predominantly negative, hopeless mood, and she will experience those symptoms for at least 2 weeks. So a woman who is experiencing symptoms for 2 weeks is having a clinical depression, versus a woman who is experiencing symptoms for 3 to 5 days is having a baby blues reaction.
Okay, so now I realize that my wife has postpartum depression. Or as a mother that has already delivered, by listening to what you've said, it's been 2 weeks, I'm weepy, what do I do now? What's my next step?
Well, the next step is to first and foremost seek help. There are so many resources out there for women who are experiencing symptoms of postpartum depression. And there are many clinicians, psychotherapists, psychologists, psychiatrists who are now trained in treating postpartum depression.
Okay, so now she realizes, or I realize as a spouse, that my spouse has postpartum depression, and she begins to get treatment. How long typically does it take for a woman to break the cycle of postpartum depression to going back to normal, let's say?
Well, we see results as early as after one session of treatment. Most women come in for one session and they're already feeling much more hopeful. They're feeling like their reaction is very normal. They're feeling a lot less stigmatized for feeling the way they're feeling. But most women will respond to a course of treatment anywhere between 6 and 12 sessions long. Some women more, some women less. I also want to point out that a woman could experience postpartum depression at any point during the first year after birth.
Wow, that's quite a big span of time.
Indeed, indeed. So it's important to recognize that if you're experiencing symptoms later in the postpartum period, that also falls within postpartum depression.
Okay, so let's say a woman is not living in sunny Florida and she can't get in contact with you, or she doesn't live in the immediate area. In other states, are there support groups, or is there a general website or contact information that you may know of that a woman can look up so that she can contact a professional in her area?
Well, first of all, I do therapy via Skype, the internet, chat, and telephone for women who are across state borders or just sometimes can't get out of bed to come to my office. They might be after a C-section and they're not mobile yet. They might be overwhelmed with a baby and can't drive to my office. So that's always an option. But aside from that, there is Postpartum Support International, which is really a fantastic organization that provides a lot of resources for women in different parts of the country and connects them with therapists in their particular region.
Doctor, is there anything that you would like to say to the women out there that are listening to you?
Remember, you're not alone in this, and there is treatment. Please do yourself a huge service and look for a clinician who can help you through this tough time. You'll be okay in the end, I promise.
Doctor, I really want to thank you for having joined me today and giving us such important information that you've given us. Thank you so much.
Thank you too. I appreciate it.